infographic presentation on symptoms, signs, and abnormal clinical and laboratory findings. As for the chapter introduction, this chapter consists of quotes encompassing signs, symptoms, abnormal result, and ill-defined conditions. Interestingly, this chapter has 14 different code blocks ranging from R00 to R99. In simpler words, signs are obvious. Meanwhile, symptoms are less obvious. For instance, skin rashes or cough is obviously a sign because a doctor and the individual experiencing the sign can identify them easily. Meanwhile, symptoms such as lower back pain and fatigue can only be recognized by the person experiencing them. Symptoms are basically subjective, which means it can only be known by the doctors if they are informed by the individuals experiencing the condition.
In this video, I am going to explain the use of symptom code. As mentioned in the guideline, the code that describe symptom and sign are acceptable for reporting purposes when the provider has not established a related definitive diagnosis. Meaning that, as long as the doctor has not yet confirmed the specific diagnosis, any codes that describe the symptom and sign can be used. This is because sign and symptom code are most commonly used during the initial encounter with the doctor. So, until a specific diagnosis is assigned, the sign and symptom code from this chapter can be reported. For example, code R00.0 tachycardia unspecified. Tachycardia is a symptom of a rapid heartbeat. Example of disease with this symptom are chronic obstructive pulmonary disease and myocarditis.
So today, I'll be explaining more about the usage of symptom codes with definitive diagnosis. So, symptoms and signs are often documented along with definitive diagnosis. This meaning which signs and symptoms routinely are associated with definitive diagnosis and which are not is relatively easy in some cases but more difficult in others. For example, in the case of a 90-year-old patient with essential tremor coded with G25.0 and unsteadiness on feet coded with R26.81, both conditions would be reported even though essential tremor sometimes is associated with gait changes, such as unsteadiness when walking. However, because of the unsteadiness on the feet is not commonly or routinely associated with essential tremor, it actually may be a symptom or sign of another medical condition, and so it should be reported additionally.
So I'm going to be explaining about repeated fall. So the code for repeated fall is R26.6. It is used when the patient is recently fallen and the cause of it is still being investigated. Another one is Z91.81. It is history of falling. This code is used when the patient have the history of falling in the past and have the tendency to fall again in the future. This code Z91.8 and R26.6 can be used if the situation is suitable and appropriate.
So today I'm going to present about NIHSS score, or we call NIH stroke scale. In this scale, there are 15 items need to be graded. The NIHS enable the healthcare provider to rapidly determine the severity and the possible action and location of the stroke. There are 5 categories that we need to be graded. First one is aphasia, the ability to speak. Second one is behavior, the ability to react to emotion. The third one is cognition, the ability to think and perform. The fourth one is dysarthria, the slur speech. And the final one is we need to be grade the vision and the perception. If the patient score up to 25 from the score, it will be recorded as very severe. And for the severe, 15 to 24, mild to moderately severe, 5 to 14, and the last one, mild stroke or mild NIHS score is 1 until 5 only. That's all from me. Thank you.
I will share 5 fun facts regarding signs and symptoms. Firstly, light headache can only be a symptom because no one could observe it. Next, medical symptoms are split into chronic, relapsing, and remitting. The third fact is that during the 20th century, new devices and techniques were created, and during this period, the terms sign and symptoms developed separate meaning. Furthermore, in 1674, Anthony van Leeuwenhoek invented the microscope, changing the face of diagnostic tools forever. Last but not least, an example of medical sign is high blood pressure, as it can be measured and observed by others.